Market Solutions. During this second podcast in the series, what is IPN's network doing in the market and solutions it can offer in the community?
Okay, well, that's stunning. So how does the IPN and the community educate the employers and patients or consumers about the value of the cost-effective, high-quality health care?
Go ahead.
Well,
April.
I was going to say a lot of it really, we work with our physicians to provide the education to the consumer or the patient at the time of service, because I think they definitely have a more valuable relationship with their healthcare provider in an independent environment. Again, there's an intimate relationship between patient and physician. When you go to any of these large systems, you're just a number on a wheel. You're just a prompt put on a phone system. You don't ever get to a human. So there is some trust value. So we really kind of drive it home to give that education from the physician to the consumers. But like Larry said, we have got to educate consumers.
Yeah. Well, I think one of the big movements among healthcare benefit programs is most employers are moving to what they call a health savings account, an HSA. And HSAs, in fact, give a deductible, but also they give a patient a credit card with X amount of dollars to cover their out-of-pocket cost. Once those dollars are expended in that credit card, you're on your own for the rest of the year. And let's just use one example. Seminole County Schools, they have about a $1,500 credit card with funds to be spent. And if they spend that out, then they're out of pocket. But let's just use one example, an MRI. If you go to a independent imaging center, an MRI, on average, the submitted charge is going to be about $600. Well, if you're on an 80-20 HSA plan, 20% of $600 is what? $120, right? If you go to the hospital, the submitted charge of an MRI is $7,000.
Which, by the way, is the same machine and usually the same radiologist interpreting.
Right. So now you got a $1,400 copay, which is going to wipe out your entire HSA account for the whole year, and now you're out of pocket for the rest of the year. That is the significant difference between accessing health care in an independent environment and accessing health care in a hospital environment.
That's amazing. So can the IPN significantly rein in those high healthcare costs?
It's a great question, because we currently are in our we just finished our third year with Cigna in a commercial ACO, value-based shared savings program. And over those entire 3 years, we provided care to almost 25,000 Cigna lives, and it's growing every quarter at 10% below the overall Cigna market cost for their entire book of business. And yet our quality score was 50% higher than the quality score on average of all the other Cigna business out there. So can independents do it cheaper, and can they do it better, and they can do it at higher quality, and can they do it with better patient satisfaction? That's a perfect example of how we can do that.
We just proved it 3 years in a row.
Yep.
And actually this third year, our last year, Cigna currently has what they call a commercial ACO, as a collaborative accountable care model, a CAC. Cigna has 240 CACs nationally, and we just scored #1 in the nation. So this model, we would love to reproduce to every federal and state legislator on the planet to fix healthcare.
We do believe that what we've done, and IPN is one piece of the physician side, but when you look at IAHN, Independent Ancillary Healthcare Network, and you combine them, by the way, that is all the freestanding, self-owned surgery centers, outpatient surgery centers, urgent care, imaging, lab, pharmacy, DME, home health, you name it, rehab, all of that. When you combine the two, that gives IPN a complete independent outpatient healthcare delivery system where we can keep these patients away from where we're going and going to the hospital. But I think the most important thing, and we're going to announce it here, is that we are starting a program. You've got Advent Health, which is Florida Hospital. You've got Orlando Health, which is Orlando Health. You've now got introducing Alliance Health, which is going to be our IPN, direct to employer health benefits program. And we are going to target and go after self-insured employers. It's incredible. And 2 years ago, actually beginning 18, Disney chose to cut out Cigna in their HMO product and go directly with the 2 hospital CINs, cutting out all the independent doctors. And I think the question earlier about can IPN really compete with the hospital systems, when Florida Hospital and Orlando Health told Disney, we have the networks and we can take care of all your patients without using Cigna and cutting out the independents, they found out without the independents they didn't have a network. So then they go out and they start trying to enlist and get our docs to participate in their programs. And some did, some didn't. And now we believe that when you look at the two systems, Orlando Health owns about 500 physician practices. Same with Florida Hospital. That's 1,000. But 50% of those 500 each are hospital-based physicians, and they have no community. As April mentioned earlier, they're not community physicians that the average patient can go to. We have 1,000 independent doctors that operate in the community that can build that entire network. So I think he's beginning to see how this makes sense from a standpoint. And our Alliance Health program, we're rolling it out 7/1. We're very excited about this program, and we do believe that it is going to drive a significant alternative product for employers and families in this community. 52% of healthcare benefits are obtained through employers in this country. But yet, of that $3.6 trillion, 53% of those dollars are paid in out-of-pocket costs by patients. And most people don't know that. The other thing is when you talk about the hospital systems, every time you pick up the paper, you see that Orlando Health or Florida Hospital or even HCA has expanded their tentacles into the outpatient arena, i.e. Centracare for Florida Hospital. Not only is that freestanding ER, but urgent care centers. Care Now for HCA and Care Spot for Orlando Health. Now, if you've got a major intersection in Florida, you got one here, and one here, and the only one left is an empty space. Last year in Florida, there were 9,000 ER visits. 9 million ER visits. And 71% of those ER visits were deemed could have been handled by urgent care or a primary care doctor at $150 versus $3,200 on average without being admitted, saving the system, just in Florida alone, $18 billion. Oh my gosh. Now, this is another staggering. Every second in America, somebody shows up at an ER. Can you believe that? Every second in America, someone shows up at an ER. And again, the lower income, we understand, they may not have access to primary care and they use the hospitals as their primary care. But we've got to stop that. We've got to have legislation, and we're going to talk about that in a minute. We've got to have programs that in fact incentivize people to access the right care at the right time, at the right place for an appropriate amount of cost. And that's the education piece that we're all about when we're doing IPN. And again, the independent practice of medicine is at best, existence is in jeopardy, because if 70% of physicians coming out of medical school today are joining the hospitals, that 44% that are part of the hospitals today, that's going to increase pretty rapidly as the older physicians retire and the new physicians come on board. But our whole core message of everything that we do, if you look at all the different programs that we do, it's truly about preserving and protecting the independent practice of medicine. And by doing that, we're offering the consumer, the patient, the employer, and even the payer an alternative to high-cost health care. And it was even deemed by Health and Human Services, HHS, that independent physicians are the solution to spiraling out of control rising healthcare costs in America. And that's our total mission.